Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome back. This is Dr. Jacobs. In this video, I'm gonna go over 3 most effective, powerful treatments to get rid or relieve occipital neuralgia pain. I personally use these 3 effective treatments with my patient because it provide amazing result and get patient back to normal by treating the root cause of occipital neuralgia pain. It's very important to understand those 3 powerful treatments has to be done simultaneously. You cannot pick and choose one of those treatments and assuming the symptoms will be released or relieved, because the problem is so complex that we have to address it holistically from all angles. So before I go over the 3 effective treatments, we need to understand normal healing cycle, because that will help us to understand and treat the root cause of the problem. So I'm gonna use external paper cut for visualization to visualize what's going on internally, but the same process happen internally from accident, trauma, or any injury that occur to the occipital area that cause occipital neuralgia pain or headache. So the first stage of healing is inflammation. As you see here in the first image, swelling, redness, and the blood start to rush to that area. Second stage of healing is a proliferation stage. That's when your body starts to build fibrotic tissue, and you can see here the scarring. Actually, scarring is part of our healing. If our body does not build the scar tissue or fibrotic tissue, it's going to be open wound susceptible for infection. So actually, fibrotic tissue very essential for our survival. The problem is we don't want too much fibrotic tissue that compressing on the occipital nerve here that will cause the occipital neuralgia pain. So the second stage of healing is a proliferation stage. During this stage, our body produces fibrotic tissue, which is scar tissue. You start to have fascial restrictions, muscle spasm, trigger points. Perfect scenario during the maturation stage, our body gets rid of everything in the proliferation stage and the inflammation stage, and everything clears up. If you have chronic occipital neuralgia symptoms, you're probably not in the maturation stage. So probably your body going back and forth between the inflammation and proliferation stage. And as you see here, this is a very small area that if you have any inflammation, any fibrotic tissue, fascial restriction, or muscle spasm in here, it's gonna compress on that nerve that's gonna cause sharp shooting pain going up to your eye. So before I go over the effective treatment, I want to touch base on ineffective treatments that you see it everywhere. We're gonna relate that to the normal healing cycle, so it will make sense why these treatments are not effective. And I will include a link for the research that shows these treatments are not effective below these videos. So ineffective treatment: ice and heat, stem, foam roller, acupuncture, dry needling, joint mobilization, stretching, strengthening. So when we look at the healing cycle here, ice and heat is temporarily gonna decrease inflammation, but it's not gonna go do anything for the fibrotic tissue, fascial restriction, muscle spasm. The same thing, foam roller, acupuncture, dry needling is not gonna break any adhesion that's occur here that compressing on the nerve. Does not matter what kind of adhesion. Is it fibrotic or is it herniated disc that could cause compression on the occipital nerve? Those are related to inflammation and fibrotic tissue that causing the compression. So the other thing that you see it in YouTube a lot is stretching. Unfortunately, studies shows stretching could cause more inflammation. And if you overstretch, you're gonna cause a tear in the muscle. So think about this way. When you have fibrotic tissue or a scar tissue, so our muscle should act like a rubber band when you contract and relax, stretch like this. So when you have fibrotic tissue, scar tissue from poor posture, poor body mechanic, or accident, that compressing on the occipital nerve, it's like you have a knot in the muscle that your muscle, when it starts to contract, will not stretch much, and that will cause more compression on the nerve. And if you overstretch, you're going to cause micro tear in the muscle and actually cause more fibrotic tissue, and that fibrotic tissue will cause more pressure on the occipital nerve that could cause more symptoms. That's why I see a lot of patients that looked in YouTube and they start to do crazy stretching exercises that actually aggravate their symptoms and made it worse, because that's not safe. And a study proved it's not effective. Strengthening exercise is the same thing. If you have inflammation and you do strengthening, you're not going to break the adhesion, you're not going to release the fascial restrictions, and actually could cause more inflammation. So in order to treat the root cause of the problem, we need to break this vicious cycle of inflammation and proliferation. So the first most effective, powerful treatment that has to be started is decreasing inflammation. So if you are in acute stage of inflammation, resting for 3-4 weeks should be enough to resolve the symptoms. But if your symptoms keep getting worse, not getting better, resting is not going to be enough to decrease the inflammation. So what I personally use that I notice is the most effective approach to decrease inflammation. We have to do those 3 things simultaneously to decrease the inflammation. So what I use with my patient, I have them wear a magnet heel too, and around their neck, and that magnet is very strong. That is the range of the magnet 3 to 4 inches that penetrate the neck area to decrease localized inflammation. While I'm doing that, I use the anti-inflammatory diet, because there is a lot of food that cause actually internal inflammation and slow down the healing process. So I have to do that with the anti-inflammatory diet. And for the patient that has chronic occipital neuralgia, that might have severe deficiency in vitamins and minerals, we have to address that. We have to do a lab to figure out which vitamins and mineral actually slowing the healing cycle, because we need a lot of vitamins and minerals for the body to go from inflammation to proliferation to maturation. And this has to be properly evaluated through nutrition evaluation. So there's vitamins like vitamin D, magnesium, C, B, required as part of your body normal healing cycle. And if you have deficiency, your internal inflammation will not go down as much. So simultaneously, I have to decrease localized inflammation, start patient on anti-inflammatory diet, and restore deficiency. So this is the first treatment, but we cannot do this treatment alone and assuming the symptoms will disappear, because we still have this chronic condition of vicious cycle between inflammation and proliferation stage. So the second treatment has to be addressed simultaneously is the fibrotic tissue. As you see here in this image, this first image for the muscle, there is no muscle strain, normal muscle. The second image is actually when you start to have a strain from accident, trauma, or poor posture for a long time, you have a micro tear in the muscle. And normal part of healing is your body gonna build fibrotic tissue. As you see, it is disgusting inside. And that fibrotic tissue will cause more pressure on the occipital nerve and cause that radiculopathy pain of radiated pain going down all the way to your forehead. So as you see here, we have a lot of muscles, a lot of complex structure here that with poor posture, poor body mechanic, you will have fibrotic tissue that compressing on the nerve. So you're adding inflammation to fibrotic tissue that make things worse. And that's why when we looked at the studies for stretching, acupuncture, dry needle, and joint mobilization, none of these gonna actually break the fibrotic tissue. We have to manually break it down. So what I personally use to break the fibrotic tissue, I use the A3 to break the external fibrotic tissue on patient, and then with the A5 go deep to break the fibrotic tissue and the muscle around it, because that could be affecting the occipital nerve. So the third treatment that has to be addressed simultaneously is the fascia restrictions. And this is very extremely overlooked by a lot of healthcare providers because there is not a lot of proper education on how significant the fascia system affect on the musculoskeletal system. So when you go next time, go buy meat, look at the white filament in the meat. You see that white filament? That's the fascia filament. That's the fascia layers. When we dissect cadaver, you see that white filament here? That is the fascia layers. And here in the head, we have glia apparatica. That's a fascia layer here, and you have fascia all over this area. So when you have fascia restrictions, so fascia, it's divided to two categories: superficial fascia and deep fascia. Superficial fascia wraps the entire body like a Spider-Man suit wrapping the entire body. That's a superficial fascia. And deep fascia is divided to apparatic fascia, epimysin, premiysin, endomysin. Don't worry, it's so complex system, but the treatment is very simple. I explain it here because it's very important to actually address the system entirely, the superficial, the deep fascia. Otherwise, you pick and choose part of the issue and will not be treating the root cause of the problem. We have to clean the whole house. We have to release the whole fascia system layers. So when you have fascia restrictions, it's like you're wearing a t-shirt 2 to 3 size too small. It's gonna compress on the tissue underneath it. Especially if it's in here, you're gonna feel really severe pressure that compressing on the occipital area and the occipital nerve, and you start to have those symptoms. And as you see, glia apparatica, it's apparatic fascia. When that's restricted, it compresses on everything underneath it. So in order to treat those fascia layers, we have to isolate them. And what I personally do is I use the A1 to release superficial and apparatic fascia layer, and I use the A5 to release the epimysin, premiysin, and endomysin. As I mentioned, it's extremely important to implement the three powerful treatments simultaneously. You cannot pick and choose. I'm gonna work only on the inflammation stage and assume the fibrotic tissue will be resolved by itself, or the fascia restriction will be resolved by itself. Usually with chronic condition, it's too late to isolate only inflammation or fibrotic tissue to treat one of these only. You have to address those three elements simultaneously. I will leave a link below this video for the tools, and if you have any question or comment, leave it in the comment section and I will answer it in the future video. See you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.